A portable oxygen concentrator he can take with him. It's been a while.
8 years ago.
Ever since the Value jet crash in Florida, however many years ago, it is illegal and restricted for one to carry oxygen aboard the aircraft, unless it's something like this. The irony of that is, although that crash was quote-unquote oxygen related, it was a chemical issue. It wasn't a gaseous issue. It had nothing to do with anybody's tank or anything else. But the overreaction is you can't take tanks on, even if they're empty. It used to be you could take empty tank. I don't know what the hell an empty tank is going to do for you. But you could take an empty tank from here to Miami and get it refilled in Miami, use it while you're there, drain it, come back. You can't even take an empty one on board an aircraft now. And in fact, when oxygen is supplied by the airline, it is basically the equivalent of another ticket. I think you said $200. It's probably, depending on where you're going, probably more than that now.
Well, I was going to Panama, and to get my oxygen, I had to get it through the fire department in Panama. And they flew it over to the Pearl Islands, and for 4 days of oxygen, that was $600 or $700. That's amazing.
As a side thought, anybody who is anticipating a trip, okay, the holidays have come and gone, everybody thinks that that's the end of it. No, we got the vacations and so forth coming, and grandchildren's weddings and so forth. If you're using oxygen, talk to your providers well in advance about making arrangements. We are fortunate enough that we have portable oxygen concentrators that we can loan out to our patients even if they don't have them currently. We can make arrangements through some networking for providers at point B. We'll go to the furthest I have ever personally been involved was somebody went to someplace in Mexico, and that was a lot of fun because I don't speak any Spanish, and whoever I was talking to or wherever they were didn't speak any English, so that was a lot of fun. But through networking, it can be arranged typically for equipment based on the other end, spot on the other end. It may cost you something because Medicare could care less that you're traveling. In fact, Medicare pretty much could care less if you use portable or not. They think you ought to be at home in bed, I guess. But Medicare won't pay two providers. So if you need oxygen while you're in Chesterfield and need oxygen in Chicago, you're almost on your own if your provider can't make an arrangement for you. And it's not all doom and gloom. I'm not trying to discourage people from traveling or scare you or whatever, but it's not as easy as it used to be. Yes, sir.
The FAA has a list of, has information on their website about traveling with oxygen and also about which oxygen concentrators they allow.
That is true.
And which airlines allow people to travel with it.
And I didn't mean to say that one, as an example, was the only one that's FAA written. It's not. There are other machines. But again, I think it would be wise to check that out in advance. Nobody likes surprises. And getting stuck at Richmond Airport is not a lot of fun. Yes, ma'am.
I've been on Concentrator. It's a large concentrator for 3 times as big.
That reminds me of another story. I'm sorry.
Anyway, don't we ever come and recycle them, clean them, or anything? At this point, we feel like a bad taste in my mouth when I put it on at night.
That's part of that same.
Her question is an excellent question. It's called what I call responsibility. Not maintenance, not service. It's called responsibility. Yes, ma'am. Your provider should be responsible for their equipment. Well, there are filters that need to be cleaned. 7 months. Sounded like you didn't get real good instruction day one, perhaps. Her question is an excellent one. What about having a concentrator or a wheelchair or a jet nebulizer or whatever forever and nobody ever serviced it? There are phone numbers and dealers on It should be on every piece of equipment you have, whether it's a hospital bed or a bedside commode or whatever. You need to call your provider.
Really, come out and bring the numbers on, which is a certain number they change.
That would be ideal, yes ma'am. But I think she has just hit on an interesting point that, again, is a whole another topic of discussion. Yeah, if you've not seen or heard from anybody, that probably means you don't get replacement cannulas, things like that. I am a respiratory therapist who's been doing this for a long time. I recommend, and it's in our literature, as a company, we recommend that this piece of plastic be changed every 2 weeks.
Yeah, it gets hard.
I'm looking around and I'm seeing people going, oh my God.
I change mine regularly. I probably drive my company crazy.
You should. Number one, you shouldn't have to drive them crazy. That's part of the service.
Well, they don't say I do, but I probably
Is
do.
it the patient or the provider to say, we need to replace these cannulas?
Do you have a instruction booklet from your provider?
That has to be.
You should have that. If it's an accredited provider, and I'll welcome any comments from Peanut Gallery here. Okay, do. This thing gets dry, it gets hard, it's uncomfortable. Sir?
That was the question, is what goes wrong with them? Can you clean them? Do they need cleaning?
Yes, sir. Periodically it needs to be wiped off with a moist tissue or a soft cloth. No alcohol, no Vaseline, anything like that, because all that do is dry the vinyl faster. These things can get brittle.
Cut you. It will cut you.
It's a potential infection control point, but it's a comfort point. I mean, it's just a common sense issue. When we set up somebody on oxygen, they get a quantity of cannulas in what's called a setup bag. And I'm sure Link here and Robert can tell you the same thing. We put a quantity of disposables, because these things are disposable. And that's a key word. They need to be used and thrown away, not used forever. Same thing's true with the humidifier. It always interests me when I'm on call on a weekend and I get a call from somebody who may live in LOUISA but not be one of our patients who want to know if they can get a humidifier bottle from us. Well, sure you can, but why? Well, my company from Charlottesville or Fredericksburg or draw a line and fill in the blank doesn't give it to them. You folks, that ain't good.
They're required to give it to them.
One would think. It's part of the service. And one more time, I don't wish to offend anybody with their politics, but if you think it's bad now, you just wait a while. Because it may come to the point that you have to clean your own cannulas. And you may have to recycle them.
Does it hurt to use the antibacterial wipes on cannulas? Will they?
As long as it doesn't have any alcohol. Just read the little label. If there are any methylparabens or alcohol or anything like that, it probably isn't going to hurt it in the true sense of the word, but it's just going to make it dry out faster. And a dry, hard, brittle cannula is uncomfortable. Hence nosebleeds, things like that.
They give us a 5 years, 1 3 months. I have to ask you.
Well, at least they supply them.
Yeah.
How often, I don't have that kind of a machine because I have liquid, but I have a lady that I don't take care of. She has that machine with that humidifier bottle. They haven't supplied her with a new one, and I noticed the other day it wasn't healthy looking, and I washed it with mild soap and water and rinsed it super good. Was that all right, Kevin?
You're a good neighbor.
That was good.
I can't imagine why a provider who starts a new patient discharged from Chippenham this afternoon wouldn't give somebody at least 2 of these. Use one for a while, top rack dishwasher,
Okay.
wash it out, whatever. Use the other one, swap them back and forth. The problem is they start wearing out after a while. The threads get loose, they leak. The little diffuser on the bottom stops up. There are all kinds of issues. The things need to be used and thrown away.
Okay. Was it something like that?
Yes, ma'am.
When I got mine, I went through the instructions. They had given me only one bottle when I got it. When I went through the instructions, So they change the bottle every, what, 2 weeks or so? And, use vinegar solutions and disinfect when, and let the thing air dry, you know, while you use the second bottle. And then when you switch back again.
Hard to do if you only have one.
Yeah, when you, that's why I asked them, I need another one, but they gave me one. But I mean, that's what was in the instructions.
At least they respond.
Yeah, they're very good about supplying you.
And the folks back there can tell you that not everybody responds. And that's what prompted for years people changing suppliers, was lack of service. I mean, this country, unfortunately, doesn't seem to know what service is anymore. So I guess it's dwindled down to home care provider.
Costs money, service costs money.
Especially with gas or diesel at $4 a gallon.
Yeah.
And if there is a strong justification for a company like mine and theirs to have portable oxygen concentrators, it's so you don't have to go to Grandma's house every 2 weeks with a truckload of tanks, at the very least. Now, is it worth the difference in the price? Over time, sure. In fact, there are a couple of different systems available called home fill that you can plug a tank onto the concentrator and refill it. That sounds wonderful, but they're pricey and you can't use just any tank. It has to be a unique tank, a unique machine. So if I win the lottery and start all over again, then I'll invest in all that kind of technology. It's awfully hard to do that at this point. I'm ready to close, but I'm going to pass around the one single item that I have probably gotten more new business from. When I say new business, somebody who is on oxygen, who's not satisfied with their provider or whatever. Because for some reason, providers don't want to stock these things. They don't want to make them available. This is nothing but a little hunk of foam that goes over the earpiece. They're called ear cushions. They cost about 8 cents. Well, a little more than that, obviously. But I am told, and have been told quite a number of times, that other providers don't have those things available. We put them in all the bags when we start off. They don't always get used, but they're there.
Roger, what I always liked was swivels.
Okay?
I was on 6 liters and I had 2 concentrators, one upstairs, one down, and 50 feet of cord in each one, but it didn't work. So I went to 225 to swivel. So it wouldn't get all gnarled up and twisted and carried on. So I went upstairs and I kept the second tank down at the centennial down at the bottom of the stairs, and I didn't switch. Excuse me, I got this damn lifesaver on my. But swivels, people don't seem to use swivels at all.
What he's talking about is a tubing connector